Thank you, Madam Chairwoman and Ranking Member. I very much appreciate your leadership in this. I've new here by about 5 weeks. I come from the hospital floor to the House floor, where for 26 years these have been very important issues and represent one of the most rural districts in the country. So small businesses are our backbone, and having employers, growing those jobs, and health concerns are obviously very important from our economy and to me, my former profession. Just a question for Mr. Clark. In terms of rural America, rural residents rely more heavily on individual and small group market, and because these economies are dominated by small business and self-employed, they're less likely to be offered health insurance through an employer. Could you explain how much more difficult this makes things for people from rural areas, from rural America?
Yep. I mean, we're seeing two things. We're seeing, one, fewer people insured, obviously, but number two, more and more people that are underinsured. So they show up in the emergency room with a card that says they've got insurance, only to find out it doesn't cover much. And so it's causing, just as I mentioned earlier, a tremendous increase in our bad debt, and we're seeing it more and more every month.
Sorry. Mr. Haynes, you stated that some form of financial support for the small business community is needed to create a fundamental fairness. How would the federal government fairly distribute financial assistance to small businesses when, given the situation with state by state, the small business community faces significantly different mandates and regulations?
Well, the issue with the mandates is not simply the cost of the individual mandates, it's the collective cost of the difference between the mandates. So it's simply a product of our federalism system. When you got a bunch of different regulations, it becomes much more expensive to comply with all of them. I was a supporter of the AHP legislation, but understand that there was concern about the federalism principles of it, and I respect and support that. A tax credit that recognizes the uneven playing field is really what I'm talking about. And the uneven playing field is basically because big businesses don't have to comply with those mandates. They simply create a self-funded program that is not treated as insurance for purposes of those state rules, and they don't comply with them. So all small businesses face pretty much the same issue. There may be differences in magnitude, but because they're not large enough to have an individually self-funded plan, they can't therefore take advantage of the ERISA preemption. They're in a position where economically the only way they can put together a viable plan is by pooling themselves with other businesses. I think the reality of a tax credit targeted at small businesses is it simply compensates for the extra costs that they pay because of an uneven regulatory system.
Okay, thank you. Any other would like to comment on that?
Well, and just briefly, the mandates in certain states often, I mean, there's a lot of good that comes from. Often it's political, obviously. People, different interest groups want to have, it's easy to, let's put it in, it's paid for. But then you look up and in the small business situation, you're competing against someone who's got ERISA plans. And now you're faced with just that situation where, on one hand, the regulation makes it impossible. On the other hand, some of it's just too expensive. There's things you don't need for you're having to pay for.